Hi, folks. My name is Dr. Amy Pearlman. I'm a board-certified urologist with expertise in sexual, hormonal, and genitourinary health. And I acknowledge that a big barrier for a lot of men coming in for a consultation on penile girth enhancement is simply not knowing what to expect during that visit. And because it's a topic that we don't commonly discuss, that can be barrier enough to keep someone out of the office. So why don't I take you behind the scenes a little bit here and give you the scoop, the inside scoop on what we may discuss. So for my patients who see me for a girth enhancement consultation, even though they're coming to see me for a very specific reason and a very specific concern and discussion, I always like to broaden up that conversation to talk about a variety of men's health concerns that that person might be wondering about, because it is common for men not to really have an opportunity to discuss the nuances of their male-specific health concerns with a provider. So because I am a urologist and I specialize in men's health, I really like opening up that discussion. So let me give you some examples here. Whenever I see a man in the office for girth enhancement, the first topic we discuss is actually everything but girth enhancement. And I will always acknowledge to my patients, before we get into the reason for today's visit, let me just get a lay of the land in terms of your overall health. That's where we'll go into, do you have any chronic medical conditions, any prior surgeries, allergies to medication, family history of prostate cancer, any alcohol, drug use, tobacco use, right? So we're going through all those basics. We talk about what a typical day looks like for that person and what their typical nutrition looks like and their exercise routine. And so you can tell it's a very broad discussion. And then a lot of the topics that we'll delve into, which the majority, it's so rare that my patients come in for girth enhancement, and that's the only thing that we discuss. Oftentimes we're discussing low testosterone. So even if someone doesn't have any particular concerns. I have a lot of guys that are just curious about what happens with my testosterone as I get older. So we'll talk about the natural history of testosterone. We'll talk about how we test for potentially low testosterone issues, the common symptoms associated with that, concern, and treatment options, and there are plenty of guys that I see for girth enhancement who are already on testosterone therapy, who are looking for a urologist to kind of take over that care. And so actually a lot of my girth patients end up becoming long-term patients with me, because then I end up taking over their hormone care. So we're definitely getting into the weeds on testosterone for those interested. And then we're going to talk about urinary health and voiding dysfunction. And as men get older, a lot of the men that I'm seeing for girth enhancement are in their 40s and they are in their 50s. And that's kind of like the prostate years. That's when the prostate tends to start growing due to non-cancerous reasons and can cause issues like weakening of the urinary stream, intermittent stream, taking some, additional time to start the urinary stream, sensation of incomplete emptying, urgency, frequency, nighttime urination. So you name it, we have a lot of bothersome urinary symptoms. So for patients who want to discuss what the basic anatomy is of the lower urinary tract, we'll get into that discussion. Then we'll talk about erectile function. And even I broaden that discussion more so just to overall sexual health. Erectile function is just one piece of that whole sexual health experience. So we'll talk about certainly erectile function. We'll talk about orgasmic function, ejaculatory function. We'll talk about any concerns regarding length. Certainly these guys are coming in with girth concerns, but I also want to get a sense on whether or not they're interested in length options as well. And believe it or not, I think some people would say, yeah, wouldn't everyone want, a longer and a girthier penis? And that's not necessarily the case. I'd probably estimate about 50% of the patients coming in to see me for girth enhancement are interested in lengthening options, and about 50% probably, are not really concerned about length. So let's see. Those are really a lot of the main topics that we get into. And then we also talk a little bit about nutrition and exercise. Nutrition and exercise are really the foundations for overall health, and that's for anybody, regardless of our body parts. And so we'll talk about what they eat in a certain day and recommendations for anti-inflammatory foods and what might be healthier options and different, tips for adding resistance training into one's, typical daily life. So yeah, that conversation can be very defined based on, girth enhancement, or we can certainly broaden that discussion. Now, I like having that discussion though, before we get into the reason for today's visit, because it helps me really build rapport with the patient before we get into a pretty sensitive topic. So we'll kind of go through all those different, topics, and then we'll get into the girth enhancement conversation. And oftentimes how I just broach this topic is I say, okay, now we're going to get into the reason for today's visit. And I have a little, I'll show you over here, little, let's see. I have a little demo station over here so you can see right there. And I'll have my patients usually walk over to that demo station and I'll have them point to where they currently are in terms of their flaccid girth if they're aware. And oftentimes people don't know exactly how much they measure. They're kind of guessing. And so they'll point to one, they'll say, oh, I think I'm this one right here. And I'll say, what are your girth goals? Where are you hoping to get at the end of our treatments? And I think a lot of people think that the typical person who comes in, has unrealistic expectations of what they're looking for in terms of girth, or they know exactly the size of their penis from the get-go and exactly what their goals are. That's really not the case in my experience. Most men come in, they say, you know what, I think I'm about here. This is where I think I'd like to be, but I'm not really sure. And that is the majority of the patients that I meet with. And that is perfectly fine. You don't have to go home and measure and get the exact measurements of your penis. That's what I'm doing in the office is I'm measuring the baseline. I'm measuring, the length and girth of the penis as we go through those treatments. So I'm fine just doing that myself and keeping those measurements so you don't have to, figure out exactly how to do that at home. So some people know their exact measurements, but most of my patients don't. So once we go through, what their goals are, then we'll really get into the meat of the conversation in terms of what the filler procedure entails and questions from the patient at that point. And I usually will, ask my patient, how much knowledge do you have about filler coming into this? Because everyone comes in with their own amount of knowledge. And I do have some patients that say, okay, don't hate me, but I did go on Google and I did some research. And, my response to a comment like that, I always encourage people looking online. I think especially when you're coming in for a procedure that not many people are talking about, where else are you going to get the information? So if someone were to come in to see me and say, you know what, I haven't done any research on girth enhancement, I really don't have any idea what I'm getting into, and I want to do the procedure today, I would actually be more concerned about that scenario. I'm not concerned about the guys who come in who tell me, look, I've been doing research for the last 1 to 2 years. I know what to anticipate. I have some additional questions to ask you, but then I think I'm ready to proceed. I don't worry about those guys because they've done their due diligence, and I think that's really important. So I'll get a lay of the land in terms of how much sort of knowledge that person may have. I work with a company called Falafel. So a lot of my patients who end up seeing me, they've already spoken to someone from the Falafel company, and they've already gotten a lot of the lay of the land in terms of the procedure before they see me. So sometimes this conversation with patients is longer and sometimes it's shorter, depending on how much research and with whom they've spoken to before coming into my office.